diagnosis, treatment, and prognosis, nothing else. Your job as a medical doctor is these four things: prevention, which is before treatment, diagnosis, treatment, and prevention. What's the genetic testing? Maybe you know about genetic a lot, but about the genetic tests, what are these tests? Which kind of test called genetic test? We have three different groups of genetic tests. The first one is molecular genetic test. Molecular genetic test means when we have DNA, when we say DNA, T, C, G, A, C, T, when we have a mutation which causes a disease, which causes disorder, and so on. For example, changing T to C, for example, in one gene. In this situation, these changing make mutation, and this one cause of a disease. How we can check it is molecular genetic. To check T, C, A, G, T, something like that. Another one is group of T, C, G, T, C, A, group of base pairs. Group of base pairs. For example, 1 KB, 1 kilo base pair, 100 kilo base pair, or a tau mega base pairs. We want to check these part of chromosome. That one is molecular genetic test, but this one is chromosomal genetic test, because we are checking the chromosome. Means group of base pair, group of genes, not one gene. Different genes together we can check on chromosome. Another one is biochemical genetic test from your, I would say from your maybe high school. You know we have DNA, RNA, protein, and the function. That's it. So when we are speaking about DNA, means speaking about the protein and the function. When we are speaking about DNA produce protein. So when we check the protein, means we check the DNA. So in this situation, this test, when we check the protein, is biochemical genetic test. Because we check the protein, this protein coming from DNA. Okay. Now I am focusing on screening test. Why screening test? When we say early detection, means detect a disease before making harm, before make harm in your body. So if you check the disease before making harm, before making a problem in your body, means early detection. But when we say a screening test is absolutely different. What's the difference between a screening test and diagnostic test? When you have a pain in your tummy, you go to the doctor. Is it? It's right. You have a pain, go to the doctor. I have a pain in my tummy. Okay. So why you go to the doctor? Because you have a pain. You have a pain in your tummy, your teeth, your wherever, for example, or something like that. It means you have a symptom. But that's the test. The doctor check your tummy, go for radiation, go for one, and so on. But for a screening test, You go for the doctor without any symptom. Why? That's the question. Screening test before any symptom. It means such as when you go for example, you want to check your blood test for sugar to see whether you have diabetes or not. What is it called? Checkup. Checkup is sort of a screening test. Understood? It means you go to the doctor without any symptom. Without any symptom, because you want to check whether you have a problem which you don't know or not. Is it clear? Okay. I have written here all tests in genetic. Whatever we have in genetic. Some of them you know, some maybe not. Before pregnancy, I'm explaining from when we are nothing, when we are sperm, nothing, to death. Which tests we want to apply? Is it to understand? Okay. Before pregnancy, which test? We have genetic tests which called pre-implantation genetic diagnosis, PGD, which I explained today. Another one is prenatal screening test, which I will explain today. Prenatal diagnosis test, which I will explain today. What I am saying today about this part. After birth, we have newborn screening test, which I will tell you. Another one is carrier screening. When we say screening, means before any symptom. Just I go to the doctor or to the laboratory to do the test without any symptom. Carrier screening test. But if I have a symptom for a disorder or disease, which is diagnostic test, which is different. Another one is we do treatment using some drugs and so on. Which we use some pharmacogenetic test, which next session I will explain, and prognostic test, which is another test to see whether our treatment works or not. Our treatment was successful or not. This one is prognostic test, and after death, also we have tests. Forensic medicine. Do you know forensic medicine?
Yes.
After death, they check the body to see what is this body, who is the murderer, who is the body coming from, and so on and so on. So that's different stage of genetic tests. What is the subject? What's the subject for genetic test? The subject for genetic test, all tests I will tell you, or I said to you here, all of these tests, the subject of these tests are DNA. We work with DNA. So, the subject for these tests are DNA. DNA, as I said to you, or molecular, chromosome, or others. So, genetic test, I want to focus on screening tests. What are screening tests? A screening test, when we go to, for example, laboratory to do checkup, what they tell you? They say, possibly you have high sugar and you have to go for next step for testing. They give you usually a risk, possibly, I am saying possibly. From a screening test, you don't get exactly the diagnosis. They give you some risk, means possibly you suffer a disease or something like that. What they have, screening test, usually some, I would say some markers or something would be very necessary to know about when you are speaking screening test. One of that is sensitivity, another one is specificity. Whenever you are speaking about test, any kind of test in your job, you are going to be a medical doctor, am I right? Okay. What's the difference between your hand exam, the tummy? I have pain in my tummy. I come to you. You are a medical doctor. I come to you. Okay, I have a tummy pain. Hey, you check my tummy with your hand, and also you can go for example, CT scan. Am I right? CT scan and your hand. Which one is more sensitive? Your hand or the result of CT scan? You are saying, I don't say, you are saying exactly right. Of course, CT scan is more sensitive than comparing to my hand. Am I right? So, is it important to know about any kind of test about sensitivity? Of course. Which one is more sensitive? Just for example, CT scan and radiography. Of course, CT scan, not just taking a picture. That's it. So, depends on the test, they have sensitivity. So, when you want to write a test, you must know about the sensitivity of the test. Am I right?
Yes.
Okay. And also about the specificity. What the specificity means? A specificity means which one is more specific. For example, the test, my hand, I can check with my hand a tumor here, a tumor, or the CT scan.
Your hand is more specific.
My hand or CT scan. I can't say this is a tumor of, for example,
Cutaneous tumor.
not hand, tumor in my body, tumor in my tummy. For example, I can check the tumor in my tummy. Which one is more specific to check the tumor? My hand, to say this is tumor of which part of, for example, colon, the colon.
Yes.
Which part of the colon is, or CT scan, of course CT scan. Which one is more specific to see? For example, I can see the tumor. I am a surgeon. I open the tummy and see the tumor. Okay, this is tumor. Which one is more sensitive, specific? To see the tumor or to cut it, take one part and see under the microscope to see it is adenocarcinoma or a squamous cell carcinoma. Of course, microscope. This is more specific and more sensitive. Am I right? So sensitivity and specificity is very important. Which tests are, this is 100% sensitivity, this one is 100% sensitivity. Which test is the best? Which one?
Sensitivity.
I suppose this test is the best one. Am I right? because this is 100 and this one 100%. Should be this one is the best, but it is ideal test, ideal. Usually, in my mind, usually tests are here. Is it a good test, for example, this one? I would say nothing. No, not this one, not this one, not this one. Usually these tests are good. If I change this one to this part like this, for example, 100%, this one is 100%. Now, which tests are good? These tests. This is called rock curve. These are called rock curve. This is the standard. This is not rock curve. This is Hossein curve because I wrote it this one. It's Hossein curve, not rock curve. But this one is rock curve, which is a standard. So these tests around here are the best tests. Understood? Okay.
Excuse me, doctor.
So
the sensitive one is related to the test, and the specific one related to the
target.
Target. So, but you give example about the sperma, and the DNA is something not sensitive in our hand.
I will explain 2 to 3 slides later. Exactly your answer. I will. No, just this one. This one. So, screening test usually is as much as possible sensitive, as much as possible specific, usually. I mean the test, the good test is as much as possible sensitive, the good test is as much as possible specific. Okay. Let me ask you a question. That would be the answer of him. You know blood transfusion?
Yes.
Blood transfusion. Which test usually apply for blood transfusion? Usually is HIV. In center of the blood transfusion. They usually test the blood when you get blood from somebody for transfer to somebody else. They check the blood for HIV. The test which they apply for this test is important to be as much as possible sensitive or specific. Let me explain. Sensitive means we don't lose anyone which have HIV. For example, I have many tests here, many samples here. The test should be or must be very sensitive to do not lose any of these samples with HIV. Am I right? Which one is very important, for example, sensitivity or specificity for these tests? Let me ask you, which one is more important, false positive or false negative? Do you understand what I mean? False positive.
Yes.
False positive means by mistake, a sample which is not HIV positive, I say positive. For example, the person doesn't have any HIV, but I say, okay, you have HIV. This is false positive. And another one is false negative. Somebody has got HIV, but I lose it. I say, no, you don't have HIV. Which one is important for blood transfusion?
False negative.
You agree all with me, false negative, because If I lose this one, I transfer to somebody else and the person suffer from get HIV. But for false positive, doesn't matter. What can I do? I say you suffer from HIV and the person cry. Cry. Why? So, what I do that? I said, don't worry. I will repeat it. Am I right? I will repeat it. And the next time I say, no, I made a mistake. No, you don't have HIV. That's it. But the first one, which is false negative, is serious. Am I right? Is it clear? So, now you understand. The test must be as much as possible sensitive. We don't have false negative. The sensitivity of the test, it should be the highest. But for false positive is not sensitivity, it is a specificity, which is maybe the test is not specific for HIV, with some other thing show positive. Understand the difference between sensitivity and specificity now. Understand about false positive and false negative. Okay, so what I am speaking about the test doesn't matter. It is genetic test, or it is blood test, or it is which kind of test, but it is a test in medicine. Which criteria a test should be, should have a test, these criteria. One is accuracy, which is sensitivity and specificity. Another one is prevalence of condition, means frequency of the population. What I am saying about the test. If we have a test which works, for example, for just one patient in the ward, we have one patient in the ward, it's not a good test which apply for checkup or everybody. No, just one disease in the ward. Doesn't matter. But when you go to for checkup of the lab test, you check, for example, blood test for sugar, for glucose, for high, for example, sugar, blood sugar. You test for blue, you test for something which is common, not very rare. So prevalence is very important. Another one is cost effectiveness. It is absolutely, it is important. You don't go for a test which is $1 million. Okay, I prefer to die, not $1 million. Am I right? Yes. That's a test, very good test, but it is $1 million. No, I prefer this one, to die. That's it. So it would be costly. Safety. There is a test which possibly when you want to get one sample from your, for example, brain, you die. No, I don't want this test. No, test should be non-invasive. For example, saying, okay, blood. Okay, I say, that's it. Or maybe in future, you don't get that even blood. You say, okay, just saliva. Give me some saliva. That's it. So it is another. Safety is very important. Another thing for test, easy to administer. It should be very easy to give you the answer. There is a test with many steps. No, we don't like this test. Another is acceptability. patients should accept this test. Otherwise, it is not comfortable. That's another thing for a test. The regulatory, Ministry of Health should accept the test. Otherwise, they don't pay. Insurance companies should accept the test. Otherwise, they don't pay. So, the system should accept the test. The test should be easy test, and also should, I would say, we can reproduce the test quickly or easily. So, in this situation, the test could be reliable. Another one is clinical utility. This test should, the patient can manage the test, and the test, I would explain in another way. Look, sometimes you do the test, but this test is not useful for you as a medical doctor to manage the patient. Is it clear? For example, you do a test, but this test is not useful for you as a medical doctor to manage the treatment. Why you get this test? It's nonsense test. It's not useful test. Because you do the test which is useful for the management of the treatment. Otherwise, it is not a good test. What I am saying is, now, I am saying about any kind of test in medical job. Understand? And the last one is follow up the protocol. You can do that. Now I am going to give you some example of screening tests. Now, what I said today, so far, I said about the tests, I said explain about the criteria and something you should know about any kind of test. Now I am going to focus on again back to the screening test. Between diagnostic and screening test. A screening test, which kind of a screening test? For example, for breast cancer, what's the name of mammography? Usually, people after age of 50, they go for mammography. What does it mean? It means they have a tumor, go for mammography, or they don't have.
They don't have.
They don't have. Means they don't have a symptom. Understood? It means a screening. Understand what is screening? Cervical cancer. What's the test? Pap smear. Pap smear. After age of again 50, something like that, they go for pap smear. It means they have cancer? No. No, it's not. They go for cervical cancer and doing pap smear. It means they don't have cancer. It is a screening test. Colorectal cancer. What's the test for that? Occult blood. They check the blood in, for example, what I say? They go for the problem for this. Do you know the problem for this test? When they get feces, for example, in laboratory, they get, okay, give me some feces, and then they check the blood in that one. They do something in their feces and check. But if there is a blood, it doesn't mean they suffer from colon cancer, because it is not. It is a screening test, but it is not specific. Why? That's the thing I want to ask you. Why? Is it a specific test?
No.
No, because
Is it sensitive test?
Yes. Sensitive, not specific.
What is not a specific? What's, for example, which problem or which condition can change the results from colon cancer test?
Maybe if someone has hemorrhoids or something.
Not hemorrhoid.
In-
No.
Or ulcers.
Oh, maybe ulcer of, but it's good for ulcer. We can check it ulcer. Doesn't matter. Colorectal and ulcer we can. But something which is very, very easy to change the results.
Bacterial infections.
What?
Bacterial infections or parasitic infections.
No, easy.
Is it a type of food they might eat?
No. Do you know what they check in the fish? No? Hemoglobin. They check hemoglobin, the blood. Blood in the feces from our body, in the laboratory. They check this one.
So if someone maybe had a nosebleed and
Bleeding,
in the nose or of the mouth.
mouse,
Mm.
toothbrush.
Mm.
Toothbrush. Do you know sometimes you do toothbrush and bleeding?
Yeah.
If you swallow that one and you do tomorrow test, it is positive. But you don't have colon cancer. Understood?
Yes.
Yes.
Understood?
And which one is most common
Which one?
from this test?
I say, for example, when I want to do the test, I say, okay, did you toothbrush yesterday? You say no. Or you say yes. I ask, did you have bleeding? You say no. Okay, go. If you say yes, I had bleeding, I say go and tomorrow come back to repeat the test. Understood? We have to ask. You are a medical doctor. You are a medical doctor. You have to ask. When you want to do the test, it is very important. Prostate cancer, the test for PSA, prostate specific antigen. All of these tests are screening tests, understood? As much as possible sensitive, as much as possible specific. Now you can understand what I am saying. Okay. I am going to explain about the test. Which test is carrier screening? Do you remember carrier screening here? Which one is carrier screening? This one. In which stage we do here between birth and a disease? It is a screening. So it means we don't have disease, we don't have symptoms. So it is carrier screening. Okay, what I am saying now, I want to explain about carrier screening. Next, I will explain about prenatal screening and then neonatal screening. So, carrier screening. Carrier screening, what's carrier screening? Carrier screening. Usually, you know this one.
Yes.
Mendel said from your high school. So, it's Mendel said. Between two carriers, for example, for thalassemia. Thalassemia is common in this area. Iraq, Iran, Pakistan, Hindustan. This area is common. Thalassemia minor or major thalassemia. So, when we are speaking about thalassemia, here we have carrier, mother, father, they have carrier. One mutation here. Is it right? They have mutation here. Okay. What happened is marriage of two carrier for children. One is absolutely get one from mother, one from father. Both of them, and this is thalassemia major disorder. One is get one from mother or get one from father, the normal one from father, normal one from mother. They are carried. Am I right? And another one get both healthy one, which is absolutely healthy. Is it right? You understand this one very well. So 1/4, 25% possibility for disorder. Am I right? 25% is high. In this situation, before marriage is necessary to check. Otherwise, 25% children are actually thalassemia major, serious. I don't know whether you have seen or not, but it is serious. Sometimes we have some late onset disorder or cancer or something which we don't know in future we can understand. At the time of marriage, we don't know. They are absolutely fine without any disorder, but in future they get disorder. For example, such as Huntington. You know Huntington? Or polycystic kidney. They lose the kidneys after the age of 35 or 40. But before that is marriage. Age of marriage is 25, for example. But after that, they have disorder. So in this situation, we need to test, to check whether these two persons which they want to marry, they suffer or they carry mutation or not. What's the name of this test? Carrier screening. You understand? It was difficult? No. It's very, very clear. What is useful for, especially for our countries? Do you know why? Because we usually do marriage between families, cousins. Am I right? It's very important. Very, very important. To prevent of disorders. Understand? No, now you can understand what's the meaning, what's the importance of carrier screening. Am I right? How we do that? Long time ago, when I was medical doctor and I do a screening, genetic, long time ago, 25 years ago, or maybe more, 30 years ago, there was no NGS, next generation sequencing. It was very difficult to detect carriers. Nowadays, it's very easy. To be honest with you. Nowadays, very easy. I do in my laboratory quickly, just 2-3 days. But at that time, month and nothing we got. Sometimes nothing. Long time ago, when I was medical doctor, long time ago. But now it's very easy, using this instrument, which is NGS, Next Generation Sequencing. That's the instrument. Recently, the instrument of NGS is like that. Here. Look at this size. In my laboratory, at the moment it's not this size, it's like this one. I will show you. Is this one and this one, that one. But but in future, when you finish your course and your study, definitely when we graduated, the NGS is like this, to be honest. And you will have, even in your office, everywhere, carry NGS. I am sure in future, not now, in future. So what they do, it's very quick and cheap. Very quick and cheap, comparing to long time ago. Comparing. So that's NGS, next generation sequencing. What's this next generation sequencing? It means with this instrument, with this system, I can sequence your DNA quickly. I can get your, our sequence is a book. It's a book, TCG, TC. How many nucleotides we have in our genome? How many nucleotides is in our genome? How many nucleotides is in our genome? How many? 3,300,000,000. 10 to 9 nucleotide. If I know about all these nucleotides in your body, I can check, I can say how you die. I can say which disorder you get. I can say even about your medicine. I will tell you next session. Today. So, it's NGS, next generation sequencing. How we can do that? We can check RNA, we can check DNA, we can check whole DNA, we can check part of the DNA, we can check some part of the DNA, whatever we want. With this NGS, next generation sequencing, we can check all these 3 to 10, 9 or some part of that. Why some part of that? Not all of that? Why we don't check
Because
not all of these 3 to 10 to 9?
Because not all of them will cause disease, or not all of them money.
Money and time. Because with this one, if I want to check all, it's a bit expensive. If I check just part of that which is related to disorder, related to cancer, related to disease, which I can do that, it's cheaper and quicker. Understand? Cheaper. And do you remember I said about many tests? Criteria to test. One of the criteria is this one. Everybody knows this one. Am I right? Okay. Look at this one. 2015, using NGS in medicine, your job in medicine was like this, in oncology, in clinical investigation, in reproduction, health. It was this one. 2025 is this one. Do you understand what I mean? The progression, the usage of NGS in the world, in medicine. When you graduated, you cannot do anything without NGS. I promise. I promise. You cannot do anything without NGS. You will see. Don't worry, you will see. When you graduated and you saw that one, say, okay, I remember what the modalities said. Okay. I remember at that time, not now. I am sure at that time you remember. Our instrument in this one, at the moment in my laboratory, which is this one, genome laboratory, it is this size. But in future it would be much smaller than that one. This is a chip, very small chip. I check all of these using this chip. Small one. I forgot to bring it for you to show you anyway. That's this size. It's my, to be honest, it's my hand. I wanted to see the size of that. Very small one. You know PCR? I am sure you know. After Corona, everybody knows. Even my grandmom knows about PCR. So, with this one, I do 400 million PCR at the same time with this one. In this one. 400 million PCR at the same time to check this one. Understood? Okay. So, what I am speaking now is speaking about carrier screening. Do you remember? Don't lose it. Okay, carrier screening before marriage or pregnancy is very important. For which disorder is important? For which kind of disorder is important?
Yeah.
Some of these disorders are example. For example, SMA, spinal muscular atrophy, and many, many others. But very important, this sentence. How many times you go for checkup, lab test for example, your sugar in your blood? Many times. Or creatinine, or BUN, or bilirubin, or many, many tests in your blood, many times. But for carrier screening, for genetic test, usually you do just once. Why?
Because the genes all remain the same. They will not
Because your
change.
DNA doesn't change. Your DNA is with you forever. Your DNA doesn't change. Am I right? Your DNA doesn't change. So, your DNA is the same as DNA when you bear at the birth and when you die. The DNA is the same. So, you do the test just once. And this test is also useful not only for you, it is also useful not completely, but half or maybe less for your brother, your sister, your mother, your father, your family. Am I right? Because your DNA is coming from your mother and father and your family. Understand? Whatever I get from this one is part from your family. Partly, not all of that. When and which reason do you ask for carrier screening test? Okay, answer. Somebody answer me. Question is very clear. When and for which reason do you ask for carrier screening test? Yes.
Maybe when the patient is thinking of having children, and if their siblings or their uncles, they have or their parents, they have a disease, a genetic disease.
Possibly. Screening test. Possibly. Not exactly. If it is exactly, it is diagnostic test. It's possibly, maybe. A screening test means no symptom. You don't have symptoms, but you want to check. You are going to marriage in a family without any symptom. Am I right?
Yes.
Family, cousins. You want to check to see whether you have a problem in both siblings, I mean both of that, or different people, and female and male, they want to do marriage. So, when you have many of these, when there is risk of assessment, possibly. In our family we have for example, thalassemia major. I want to change. It doesn't mean I suffer from thalassemia major, but I want to check whether I am carrier or not. Or maybe family planning in your country, maybe. Or maybe due to familial risk, maybe early detection and intervention for some thing, such as, for example, SMA. SMA is very, very common in this country and also and SMA is very, very expensive. I mean, treatment of SMA is very, very expensive. Very, very expensive. Means one injection is $130,000 for each injection of the drug. You understand how much? So prevention is better or treatment? Of course, prevention. Of course. So it is very important. Another one is emotional or psychological. Maybe somebody has a fear of the disease. They want to do that. Or prenatal testing. They do that. Cost effectiveness and reason. Supporting family members, other members of the family, and contribution and awareness also. So, what I said about so far, I said about carrier screening. Is there any question about that? Because we are going to prenatal testing, carrier. Prenatal carrier screening. How we can check it? It is very important for yourself, not for. Actually, you are going to have children. You are going definitely. I am sure you are going. You are going to have children. So this part of this session is very important for yourself first, and then for your patients. No, for yourself. Which is prenatal testing, prenatal screening test. Prenatal screening test, usually all in my laboratory, all, I am not saying some or part, I am saying all medical doctors, female or male, they come to me for prenatal testing. All of them, when they go for pregnancy. When they go for pregnancy, they come to me for prenatal testing. We have two kinds of prenatal testing. One is chemical. Do you remember DNA, RNA, protein? We check the protein. Sometimes we check it. And another one is we check the DNA. Two kinds test. One is chemical screening, another one is DNA. This one is much, I would say, very, very sensitive. This one is not sensitive. This one is very cheap. This one is more or less cheap, not very cheap. At least in Iran. But in Dubai is much expensive. This one is very cheap, to be honest. Understood? What's the difference and how we manage, you as a medical doctor, manage that? Prenatal testing. I am not saying prenatal screening. I am saying prenatal testing. Look, the test means screening or diagnosis. So, sometimes is a screening test. Means one person, pregnant, come to my lab to do a screening test. It doesn't mean this person has got or suffer from disorders. It doesn't mean. Understood? Doesn't mean suffer from disorder. What this means coming to my lab to check, for example, for whether the baby is Down syndrome or not. Understand? The baby is Down syndrome or not. But doesn't mean it has Down syndrome. Baby. Understood? It is a screening test. And it is non-invasive. Non-invasive means I don't check the baby from the uterus. I check blood test of the mother. It is non-invasive. So we check that one. We get the blood test. We check first trimester or quad test. Quad, called quad. These two are biochemical. You remember biochemical? Protein base, not DNA base. Protein base. We do check this one with low sensitivity, low specificity. Or we do NIPT, non-invasive prenatal testing, non-invasive prenatal testing using DNA. Which kind of DNA? Baby fetal DNA, which is in blood test, blood of the mother. Understand? Which we check this one. If we have problem here, we go for diagnostic test. Understood? If we have problem here, because a screening test just give us a risk, not diagnosis. Give possibly you have a Down syndrome baby, but not going for abortion. No. You have to go for another test, which is these two, amniocentesis or CBS sampling, which I will tell you. Understood this one? So, what's quad test or chemical? In chemical, we check AFP, HCG, inhibin, and so on, the proteins. You remember DNA, RNA protein? We check protein, these proteins. We check these proteins. If it is one of that is low, one is high, we predict possibly the baby is Down syndrome. But with NIPT, non-invasive prenatal testing, which is coming from DNA, usually the DNA from fetus, you know fetus? DNA from fetus come to mother's blood. What we check in this situation, we get the DNA from mother and we separate the DNA, mother's DNA and fetus DNA. We separate them, that, and we check fetus DNA. Understand? We check fetus DNA. What this means, if we see in fetus DNA, we have 2 chromosome 21, we say this baby suffered from Down syndrome. Exactly. But not exactly. We say possibly, because it is a screening test. Do you remember 2 criteria for a screening test? One is without any symptom. Another one is the result is not exact. The result is a risk. We say possibly the patient is Down syndrome, the baby, the fetus. Okay, understand this one? How we do that? Using NGS. Do you remember NGS? We use the NGS. We check the DNA, many DNA using this instrument, and we check that. How much is the accuracy? Do you remember accuracy, sensitivity, and specificity? Exactly. Look at this one. The accuracy, reliability is 99%. I don't believe 99% because I have done it 1,000 tests in Iran. I signed that one. Even in Middle East is not as much as one. me, they have done it. I have done a lot compared to other countries. This one. In my experiment, I mean personally, this one is not 99%. It's about 97 to 98. My personality, I can say. Anyway, so because I have done it a lot, 135,000 NIPT I have done it so far. So, in my experience, 98, something like that. We have contradiction, means sometimes we cannot go for NIPT. There is some limitation for NIPT. For example, false positive, false negative, detection limitation, and not, for example, I would say, do you remember this one? Do you remember this one? Blood DNA. This is called fetal fraction. If the DNA of fetal in the mother blood is very low, we don't do test. We don't. We have to repeat that. For example, 1 week, 2 weeks before or after. We have to wait for 1 week later, 2 days later, and repeat that. Because this one is low. Now you can understand what I am saying here. I say fetal fraction. Do you remember that the white DNA? The white one is fetal fraction. If fetal fraction is low, we don't do that. That's the limitation of NIPT. Understand? And we have some contradiction of NIPT. Means we don't do the NIPT at all. For example, when we have triple. You know triple? 1, 2, 3, baby, triple. When we have triple, we cannot do NIPT. Do you know why? Because I don't know the DNA is from which one. Understand? I cannot know which one is the DNA. I cannot do NIPT. Is it clear? So when we have, for example, triple, sometimes religious and some. For example, in some country there is no, I know in Iraq, for example, there is no abortion. So what's the results of, if I say, okay, suffer from disease or suffer from Down syndrome. So what? Because they cannot go for abortion. So that's religious law, or you understand, in this situation we cannot do that. I know in Iraq there is some limitation. In Kurdistan, I suppose we can, because I have done it many in Kurdistan, but I don't know about south of Iraq or some other countries. Technical limitation, poor sample quality, and so on and so on. Sometimes there is some. So,
Can I take this?
sorry?
Yes.
Yeah, finish. This one, finish, and we can go for that. That's the same system I tell you. The prenatal testing according to NIPT. If we have NIPT, we have to go for the next test. Timing of the test, just tell you timing, and then something, for that. Look at this one, the weeks. 5 weeks of pregnancy, 7 weeks of pregnancy, 10, 13, 15, and 20. Usually we do test here, not here. Why?
Is it because early detection is better for abortion?
Yes, because abortion after 20, it's not allowed.
After 50 is not
After 4 months. After 4 months, we cannot go for abortion. in Iran. I don't know in your countries.
After
Is it
5
the
weeks,
law?
the heartbeat
After?
of 5 weeks, the heartbeat of baby comes after that motion is allowed to be assessed.
It depends on your country. I don't know. It depends. But in Iran, we do everything between this age. I mean, we do some serious sampling or some other amniocentesis. But after that, we cannot go for. So when we are going for NIPT, we do NIPT here, just here. And I tell you just a few minutes later. Okay. You want the gap?